Hi, this is Dr. Bob Dannenhoffer of the Public Health Office for Douglas County. Today is March 17th, St. Patrick's Day, and thus my green attire. We have a couple of great questions today, and if you have questions for us, please put them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to them. But as usual, what we're going to do is we're going to start at the world level and then move down to the local level and tell you what's going on with COVID in our world. So at the world level, pretty much things are getting better in most of North America, South America, and Africa, although we really are seeing an increase in number of cases in China. Now, you remember China hosted the Olympics about a month ago. They've had very little COVID during much of the pandemic, and now they're seeing an increase. We're seeing an increase in cases in other places that did not have a lot of disease early on, places like New Zealand, places like Vietnam, places like Taiwan. They're all starting to see a slight increase in cases, almost all due to Omicron, either the BA1 or the Omicron BA2. So we're going to watch to see what happens there. In China, most of the people there got the Chinese vaccine, which seems to be much less effective than the Western vaccines. In the US, we're seeing a continuing decline in the number of cases, and we now have a number of cases that we've not seen in about 9 months. So you remember last spring, there was an increase in cases when we had Alpha, and then by last June, it was pretty quiet, and then in July, it started picking up again. We're down now to a low number of cases like we haven't seen since before June. In Oregon, the number of cases continues to decline, so that about each week we have about half as many cases the week before. No real hotspots in Oregon. A couple of cases of BA2 in Oregon, but pretty much it's BA1. In Douglas County, we've also seen a huge decrease in cases. You'll remember we were over 1,000 cases just a few weeks ago. We were just 60 cases in the last week. So it really does appear to be coming down in Douglas County. All of our cases locally are BA1. We've not seen any BA2 here yet. So it looks like things are going pretty well in the US. But we are looking at that, and we'll talk a little bit more about variants in the future. We're also starting to see that restrictions are being lifted. So mask restrictions in schools and businesses are now relaxed, and that's certainly a good thing. And just in my looking around town to see how busy things are, it really does look like business has picked up at places like bars and other gatherings. So that's good. We're a little worried that we might see an increase in disease, but we have not seen that in this last week. It has really continued to be pretty quiet. Our number of hospitalizations is lowish. We'd love to see it down to zero. It's not there yet, but we're down pretty low in the number of hospitalizations. The other good news, and this is one of the questions, is about the antiviral drugs. We now have a really ample supply of both injectable drugs like sotrovimab and oral antiviral agents like molnupiravir or Paxlovid. So the hope is that with having these antiviral drugs that can reduce hospitalizations by as much as 90%, even if we do have some cases, we can treat people early and prevent the severe disease, hospitalizations, and deaths. Now, that's the other news. We're continuing to see deaths. We had just 4 reported the other day, and quite a few deaths now that are coming from that Omicron surge. Remarkably, almost all of the people who die are not up to date on their vaccines. In fact, when we look over the last month, we just have a handful of people who are up to date on their vaccines, whereas we know that about 45% of the people in the county are up to date. So being up to date on your vaccine is tremendously preventive against hospitalizations and deaths. So please, if you've not gotten vaccines, get some. If you've gotten your vaccines but haven't yet gotten to the booster, please, please, please get to do it. Almost all the clinics in town are giving booster shots. Aviva's open each day to give those booster shots. So please, let's go ahead and get those. Go ahead and get those done. The other question this week was, what about this stealth variant? So let's talk about that. So Omicron came out. It was dubbed a BA1. It has a lot of mutations in it, a lot of different mutations from previous strains. The thought is that it probably went from humans in the fall of 2020 to an animal population, probably mice or rats, in Africa, and then spread back to the human population in November or so of 2021. At the time, there were 2 variants of it, BA1 and BA2. They don't look like they evolved from each other. They look like they kind of co-evolved at the same time. In the beginning, BA1 was the predominant variant almost everywhere except in Denmark. And now what we're seeing is that both in some places it's BA1, some places it's BA2, and most ominously in the UK, what we're seeing is that a big spike of BA1 went down, and now they're having a little spike of BA2, and that's a concern that that could happen elsewhere, that this BA1 spike goes down and then the BA2 comes up. We're going to be watching that very carefully. And one of the ways we watch, which is another question this week, is in looking at sewage. This is to me one of the most amazing things about analytic chemistry these days. So about 20 years ago, we began to recognize that by looking at wastewater, you could tell a lot about a population. And so early on, this was done with other drugs. And so you could look at a population and see that there's a lot of Tylenol in the water. And the answer is, how in the world does Tylenol get in the water? Well, people take Tylenol, they excrete it in the urine or in the stool, it gets into sewage, and then you can actually find Tylenol and its derivatives in the wastewater. Well, they use that not only for drugs like Tylenol, but they also use it for other drugs like illicit drugs, methamphetamines and opiates. And they could see in populations when the use of these things increased or decreased. And it was really quite fascinating. Wasn't sure what you could do with it, but during the COVID pandemic, we found that you could find little scraps of COVID RNA in the wastewater. And by finding that COVID RNA, you could actually find it in the wastewater before you found it in the population. And so it actually has been pretty good predictive method when things are going to happen. So the CDC has a bunch of sites around the country. Oregon Health Authority has a bunch of sites around Oregon where we monitor the wastewater. And we're starting to see some blips in the wastewater, especially in Detroit, Chicago, and New Orleans. So we'll start to see if there's going to be an increased amount of disease. The other thing that wastewater can do is not only tell you how much COVID there is, but they can actually sequence it and tell you which variant it is. So it'll be interesting to see over the next few weeks whether we have an increase. In Oregon, we've got a real decrease in the amount of COVID RNA in the wastewater. So it looks like we're going to come down. So it looks like for now, we've got 6 things happening at the same time, which is pretty remarkable. And really the first time during the entire pandemic that I can be so hopeful. So in June of last year, we had a low number of cases and low number of hospitalizations, but at that time, there still wasn't widespread vaccine available. There were really no therapeutics available in June of last year, and we really didn't have enough testing. And when we looked in June, we could see that there had been a huge spike of Delta in India, and there was a concern that it would go from India to the UK to the US, which is exactly what happened. Right now, however, we have conditions that have not been seen before during the pandemic. We have a low number of cases and hospitalizations. We have plenty of tests. We have plenty of antiviral drugs. We've got plenty of vaccine, and the vaccine still seems to work pretty well. And we have no worrisome variants on the horizon. So at this point, with all those good things, I think it makes good sense to go ahead and relax restrictions. And I think getting rid of the masking is good. Now, but what does this mean for people? Well, it's not gone. We're still seeing 10 or 20 cases a day. So it's still out there. So what would we recommend? Well, at this point, we'd recommend please enjoy yourself. But if you're sick, please stay home. Again and again, we've seen outbreaks spread by somebody who's sick, deciding to go to work or deciding to go to a party, and then exposing lots of other people, and then it just spreads along the way. So if you're sick, please stay home. If you're sick, please go ahead and do a test. Usually the second day is the best day to do the test. If you're negative, that's a good sign, and you can go back to work when you're feeling better. If it's positive, stay home and give us a call, and we'll tell you how to deal with that. The other thing we're saying is if you're going to go to a high-risk situation, please get tested. We had an outbreak this week that was in a nursing home where a sick person visited somebody in the nursing home and then spread it to a bunch of people in the nursing home. Older people don't do as well with the disease and don't do as well with the vaccine, so they're more likely to get sick. So especially if you're going to visit someone who's older, please go ahead and get a test. The tests are now widely available. We have a bunch in public health. You can get tests through the federal government. There's a bunch of places around the community. You can get tests. You can get tests at the grocery store. So please, if you're going to go see someone and see someone who's sick or see someone who could get really sick from COVID, please go ahead and get a test. Other than that, it looks like things are pretty good right now, but I can tell you I'm spending many hours every day searching through all the data in the US and around the world to see if there are new variants that are popping up. And we have a little bit of worry about this BA1, BA2, but I think right now we're probably going to be okay for now. So please enjoy yourselves, but be safe. If you're sick, stay home. If you're sick enough to stay home for a day, go ahead and use a test. And then don't go back to work until either your symptoms are resolved or if you have COVID until at least 5 days after the onset of symptoms. We're going to be doing this every week for a while. I think there's going to continue to be good COVID news for the next while, but we'll keep monitoring it and keep everybody involved with what goes on. But starting next week, we're going to start with COVID conversations. And at the end of each conversation, we're going to tell you about some really exciting public health stuff that's happening in Douglas County. So we're going to be calling this next week, COVID Conversations, ... and more. And so next week, we will have some exciting stuff to tell you. But for right now, looks like COVID's pretty quiet, but still be careful. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thank you.